Thank you all to the reviewers for scoring this application. This is a project that we are very excited to have begun. We're looking at the risk for COVID infection among substance users. This is in Skid Row, Los Angeles. Our team are a number of people, both Sang-Yuk Shin from the School of Nursing, Lillian Gelberg from medicine at UCLA, Alicia Chang, who's actually head of the Los Angeles County Health Department, previously in TB control and now in COVID. And we are still investigating the actual serology that we'll be using. So next slide. So this is Skid Row. If anyone hasn't been there, it looks exactly like this with tents on every block. It's a 54 block area close to the Flower District and Fashion District, and it's between 3rd Street and 7th Street and Main and Alameda. So we work actually in the Union Rescue Mission, which is on the right-hand side, which is the largest mission that started in the 1800s. And hundreds of homeless people live there and have a number of different services. So basically the interest in our study was to, I think I missed one, is really looking at homeless populations. This population is primarily African American and Hispanic for the most part. So it is a critical epicenter for COVID. Based on our work with Alicia Chang, particularly in the hotspots, the rate of positivity has been 60%, generally ranges to 10 or 15%. And the stay-at-home policies that are most likely unattainable in a Skid Row or a homeless population have to some extent been done, but have actually led to issues relating to social isolation and resulting, we believe, and we're going to be testing, exacerbation of drug use, as well as depression and mental health issues. We also know that the homeless are at significantly higher risk for COVID because of their comorbid physical conditions, poor diet, low immune status, vaping, smoking, lots of respiratory diseases. And so it's really important that we begin to evaluate the situation, particularly because of insufficient needle exchange sites that are open, restrooms, hand washing stations, etc. So this will be a really critical study to really give an indication of what is the impact of COVID among the highest risk population that we know of. So the aims of our study were to first really get informed by the experts that are in this area. So we have formed a community advisory board made up of homeless adults as well as health and social service providers. And they are refining, they have refined the semi-structured interview guide that we're going to use for our second aim, which is focused on actually doing semi-structured interviews with about 20 recovered homeless adults who actually are using substances, as well as these providers in the healthcare area, as well as social service. In terms of the third aim then, once we have that information, which is very formative, we then have structured instruments that we'll be using. We have 100 homeless persons that we'll be engaging. Half of them will have been diagnosed as positive, and the other half not tested or not diagnosed as negative. And then using serology, we'll be able to compare differences in antibody titers among both those that were tested positive and those that we consider to be in the control group, and really look at the estimate of prevalence among this group. This is a mixed method study. We're going to nestle it into our current NIH funded study, which relates to hepatitis C treatment among the homeless population. As I mentioned, we are in collaboration with Los Angeles County Department of Public Health, and our model has always been for the last 30 years that we've been working in Skid Row is looking at nurse-led community health worker models where we're able to understand and really reach the population that we need to with nursing guidance, and also teams of physicians and public health advisors as well. These people to be included in our study for the first aim, they had to be COVID positive. But as you saw for the second aim, they half have to be positive and the other half negative or not tested. Self-reported homeless, they have to be using substances and age 18 or older. And this will be done in this Skid Row area for people who happen to be in shelters or in the hotels where they're being placed right now, as well as in the street. I'm not going to go through all these measures, but these are all the structured measures that are going to be used in our aim that's doing the structured survey. And we're basically looking not only at demographic, but housing and social support and isolation, drug and alcohol use, and psychological issues, depression, emotional distress, etc. In terms of laboratory testing, a critical comment that we got in our review was, instead of the microarray, you may want to think about ELISA. So we actually are considering this very seriously based on the review and thinking about using the ELISA testing to detect antibody response against the SARS-CoV-2 protein, which is the N protein, as well as the receptor binding region of the spike protein. So this is something that is going to be in our, towards the end of the study, we'll be analyzing these data. What have we done so far? So we were funded a little bit more than a month ago. We've already completed our community advisory board work. We had, as I mentioned, both homeless adults as well as community health specialists from Los Angeles County Health Department, the Union Rescue Mission, substance use disorder advocates, as well as mental health advocates. In total, there were 14, and we actually had a few more after this, so about 18 or so. And I will go over the findings very briefly in the next slide, but they were advanced practice nurses, physicians, substance use mental health specialists, and community health workers that helped guide the future aspects of our study. They've already refined the semi-structured interview guide. This will lead us into our third aim that will be actually doing the focus groups, and then the structured questionnaire will follow, as well as training of the research staff has been ongoing right now. As I said, we're getting ready to go into the field with our hepatitis study. So these will actually be side by side. And we've already submitted our IRB for AIM 2. And then these are just very briefly some of the feedback that we got from our CAB. We're still in the middle of doing our analysis of it, but extreme loneliness, especially by homeless adults who've been quarantined. Many of them are struggling to deal with the loneliness, and some of them are actually turning to more drug use because trying to cope with lack of psychological support services, drug use support services. So this is really one of the most important issues in our study, is to understand, how is drug use changing? How is the pattern changing? Is it increasing because a lot of the resources aren't available fully operational yet? How are they dealing with their mental health issues? So many of them are turning to drugs to deal with depression and anxiety. The healthcare providers talked a lot to us about COVID fatigue, and really understanding from providers, how do we pay attention to the usual tremendous healthcare issues they have, diabetes and hypertension and health promotion, when COVID is the conversation for the entire day. They talked about the increased violence that's being experienced on the street, and safe places that people can use their drugs. Where are they? Does that really exist? And a lot about the logistics that we will be interested in, about logistics of testing and strategies of returning for results, et cetera, and connecting to the frontline workers. And so my last slide are the next steps. Our IRB has been submitted. We expect to hear within the next 2 to 3 weeks to get approval. We will then initiate AIM 2, which relates to doing our semi-structured interview, one-on-one interviews with homeless adults and providers. We will seek additional refinement of the structured questionnaire leading into the final component, which is the structured survey of 100 homeless adults. And then the lab testing will then be part of those last particular aims. And we've already submitted another grant. We are also have abstracts under review. So we are very interested in disseminating the findings as well. So questions, if we have time.
Thank you very much. I think we do have time for a couple questions. Well, I have one then to get it started. So looking ahead, you probably have some ideas about some of the results that you're likely to see in the study. What is your plan for providing those results to aspects of the state health system or local community health systems to try to affect changes in how the healthcare is delivered?
Yeah, that's a great question. Because Alicia Chang is part of the study, she's from LA County Health Department. She's very interested in the results that we're finding. She has been giving us, as part of our community advisory board, the frontline workers in the substance use area and mental health, so that we have a really clear understanding going into the study of what's happening on the ground. And then they will continue to work with us, and we will be feeding them back the information of what we're learning so that they could begin to think about how their interventions can be tweaked or revised so that it would be most appropriate to what is being found on the ground. You know, they don't have the time to do research, but they're very interested in helping us to do this work.
I was wondering if there is any possibility of a cost-benefit analysis that would indicate that it's economically beneficial to take care of people before they become ill with a contagious disease, that this could be used to leverage more funding.
So we will be looking at prevalence of COVID. I think that information is easy to find. We have done it traditionally in many of our previous studies that we've done in Skid Row. So I think we can really think seriously about that.